Hi, my name is Tiffany, and today I'll be performing the insertion of an NG tube, feeding a patient, and a gavage. I'm going to scan the room to show that I'm the only person in here at this time. Show what they do. Okay, so first I will recite my 12 safety practices. I will identify the patient. I will perform hand hygiene, verify the facility policies and procedure, consult the manufacturer's recommendation for the procedure. I will knock on the door. I will verify the patient by 2 means. I will note the overall condition. I will don PPE. I will raise the bed for proper body mechanics. I will explain the procedure. I will, once the procedure is finished, I will let the bed down and enact any safety devices that's needed for the patient, like side rails up, call light, things of that nature. And then I will document any abnormalities. First, I'm going to start with inserting the NG tube. I will knock on the patient's door. I will perform hand hygiene. I will put on, well, let's see. I will, raise the bed to promote proper body mechanics. All right. No more gloves. I will raise the patient to high Fowler's position. Oh, I take it back. Before I raise the patient, I will do a focus assessment on the abdomen. I will look at the abdomen and note the overall condition, making sure it's not distended or any discoloration, and then I will listen to the quadrants to see if they're hypoactive, normal active, or hyperactive, and then I will palpate. Then I will raise the bed to high Fowler's. Get my NG tube. get a towel, place it with the patient. And I'll have little tissues just in case it's needed. Have a cup of water. Okay, I've performed my abdominal assessment. So now I will inspect the patient's nose to see if there's anything that will be that would stop me from going into their nares, like any type of obstruction that would be there. And then after that, I will inspect their mouth, and we'll get a tongue blade and depress their tongue and inspect their mouth to make sure that there's no obstructions that will be there that will stop me from performing the procedure. And then now I'll get my lubricant. Oh, and I make sure I had my cup of water that's already there. I'm sorry, I will not get the lubricant now. I'll measure first, starting from the nares to the earlobe, and then from the earlobe down to the xiphoid process. For this one, it's like about 39. So this is tape at that point. Tape over it. And I'll make it as well. The red marker. Now I will lubricate 3 to 4 inches of the tubing. I will ask the patient to hyperextend their neck, so that way it's an easier flow going down. Patient hyperextends their neck. Well, I have to measure the patency of their nares to see which one will be best to go into, and we're gonna use the right nostril. So that's hyperextend the neck. Once I get that to the back of the neck, give the patient some water, and then tell them they can relax their head, and they can take some sips of water to help the tube go down. Okay, so this mannequin is not allowing me to completely go down the throat, the tubing, but like I said, I would go down to 39. Now, the tube is there, then put a piece of tape on the nose, and I will check the placement of the tubing. You check that by x-ray. It was the most proficient, and if you can't do x-ray, then you'd use a syringe, and then you test for the pH, and I'll do that in just a second. So if that were to go all the way down, that like it is not doing currently. To secure it, to ensure that it's not sliding around anywhere. I guess the whole time I'll be doing this, I'll make sure that this stays in place so that way it's not moving at all. And then I would place this on the patient's clothes, secure that to make sure it's not going anywhere. And once that is secure, at this point I will go I will test pH to ensure that it is properly placed. Get the syringe. I will draw up some of the gastric contents. Syringe. And I just spilled the drink. Use my pH test strip. And I will test it and make sure that it's about 5.5 and we're good. This place. Now I will hook it up to the intermittent suctioning on the wall. So here I will ensure that it's set to intermittent on the wall. And it's on. We'll connect it to showing that my line is actually going up and it is connected to the suctioning on the wall. So as you see, intermittent suctioning, you can hear it going on and going off. And you will set it between 80 and 120. Once that is done, the pH has been checked and it is in showing that it's in proper place. I will clean up all of my supplies and then I will document the time that I placed it, the length of the tubing itself, as far as how far it's down, and then I will lower the patient down to proper body mechanics, give them their call light, make sure side rails are up, and that will end the insertion of NG2. Next, I will, the order calls for perform a gastric lavage via NG tube with nasal saline until contents are clear. So, already I will have my saline. So what I will do first, well, obviously I will knock on the door, identify the patient by 2 means, and then I will get the NG tube. And then I will get my syringe. I will draw some contents to test for the pH. Dab on the pH strip. It's at 5.5, and then now I will make sure to check the saline, make sure the date is good, make sure it's at room temperature, and then I can pour some saline into a container, get the syringe, and draw up some, insert it into the line, press the water in, and then use gravity to let that run out, and then from the stomach, and then come back in, making sure, and then I'll continue to put more saline in here, put it into the NG tube to go into the stomach to flush back out via gravity and get all the contents drained out that were there. Once the contents are clear, they come back out, I will close this off. I will clamp it, make sure there's no air getting in. I'll insert the tube in, and then I will, after I've put the patient back down to a good condition, a safe condition for them, I will document the procedure by annotating how much came out, the color of it, any consistency, and then documenting that I showed that it was still within the stomach. Okay. Once all that's finished, I'll give them their call light, put the safety rails up, and like I said, document, and that'll be in that procedure. Then the next order calls to administer some Glucerna, 100 milliliters with 50 milliliters of water flush per NG tube every 4 hours, as long as the residual is less than 150 milliliters. So with that, I will go back into the patient's room, will knock on the door, identify them by 2 means. I will raise them to the proper working mechanics. Then I will get the NG tube and pull, make sure I clamp it, pull that out. We'll insert this, pull out any residual, and then test it. Yep, place that in there. Here again, pull out, test it. All right, residual is less than 150 milliliters. Now what I will do, I will get about 25 to 50 milliliters of fluid, and I will put into the line to ensure that it's clear, so that way I'm not giving them fluids and then it's just being clogged up. So now what I will do with the Glucerna, I will look, make sure that the date is not expired, and that it's the correct formula I need. I will shake it up, make sure it's mixed properly. I will clean the top of it off with, and with an alcohol swab, and then make sure that it's at room temperature so that the patient doesn't go into shock. And so once that's done, open it, and at this point, if I want to, I can have this syringe that would be there, and then slowly pour the Glucerna in there to feed inlet, gravity pull it down so that it's going no more than 18 inches. And then once it goes down, then I will come and put more in and let that slowly go down. And then I will ensure that before all of it is complete, that I get the water, that get 50 milliliters of water and pour it in here, so that way it's that flush. And then I can either let gravity slowly pull it down, or I can intermittently push the water down myself to ensure that the line is clear, ensuring, well, I'll put 60 milliliters of water in there to make sure that all the 50 goes down. And then once it get down to 10 milliliters left, I will ensure that I close it off, so that way no air goes into the patient. And then I will disconnect, and then I will hook that back in there. Make sure that everything's good. I will clean up my stuff. I will lower the patient bed to proper body mechanics, get them down, and I'll lower the bed as well. And from there, I will give the patient their call light, make sure the side rails are up, and then I will report everything that I did, to include how much fluid was given, how much of the feeding that was given, whether or not they took it well, if there were any type of reactions that was given to it. And then I'll keep the patient at least at a 30-degree angle to ensure that they are not going to aspirate on anything. And once that is done, I give them that call light, clean up all of my mess, wash my hands, and then I will document the procedure. And that concludes the NG2 lavage and clavage. Thanks.